The Illinois State Medical Society is pleased to present this overview to help you make your own personal decisions determining your future medical care. This presentation offers practical information about living wills, powers of attorney for health care, mental health treatment preference declarations, do not resuscitate decisions, and organ donation. Advances in medicine and medical technology now can save many lives that only 50 years ago might have been lost. However, the issue of quality at the end of life has come under intensive judicial and public scrutiny. In the state of Illinois, you have the legal right at all times to determine the degree and kind of care you wish to receive. This includes your right to consent to or refuse medical care and treatment as long as you are capable of doing so. You can also direct your physicians and family about the care you want in the event of an illness or injury, including terminal illness, if you reach the point at which you are no longer able to make these decisions. You can decide if you want procedures such as artificial breathing and kidney treatments, feeding through a tube or a vein, among others, if they would only prolong the process of dying and do no more than delay your death. Decisions about the quality of the end of life, such as life support systems, aggressive resuscitation efforts, hydration and nutrition of comatose patients, are all serious personal decisions that each of us must arrive at privately. If you wish to exercise your right to determine the care you receive if you are injured or gravely ill, this guideline will help you make an informed decision. In Illinois, 4 documents are available that you can use to direct your health care when you are incapable of doing so: the durable power of attorney for health care, the living will, mental health treatment preference declaration, and the uniform do not resuscitate order. These documents are known as Advance Directives because they give your directions in advance. You can use any one or more of these documents, or you may write out your wishes and directives. The choice is yours, and you can change your mind at any time, except for the mental health treatment preference declaration under specified circumstances. If you have a durable power of attorney for health care, you do not need the living will or the declaration for mental health treatment. However, you are always free to complete each of these advance directives, and the Uniform Do Not Resuscitate Advance Directive, or DNR, is advisable for everyone. The DNR is also known as the Post Form and is now accepted by several other states. Using the Durable Power of Attorney for Health Care form, you can designate someone else, called an agent, to make decisions about your health care in the event you are unable to do so yourself. This person can, by law, be anyone you choose who is over the age of 18, except a physician or other health care professional providing you with care. This person will have the legal right and responsibility to make decisions about your health care, including the initiation and termination of medical procedures and life support systems, organ donation, and autopsy. For example, a person with irreversible brain injuries remains in a coma from which doctors have determined the patient will never recover. The agent designated in the durable power of attorney for health care can refuse the antibiotic treatment that the hospital would administer if the patient develops pneumonia. Without antibiotics, the pneumonia would most likely be fatal. Because the patient has determined in advance through discussion with his or her agent and by signing the durable power of attorney that death should not be delayed in this circumstance, the agent is authorized to decline life-saving efforts. Most people select a family member or a close friend to act as their agent in these situations. An agent must keep a record of all receipts, disbursements, and significant actions taken under his or her authority as the agent, and provide a copy of this record when requested to do so in limited circumstances. You may designate several agents in case your first choice of a decision maker is unavailable or unwilling to serve. Whomever you choose, you should discuss your wishes with them. If you execute a second power of attorney, it does not revoke a previously made power of attorney unless the subsequent power of attorney document specifically provides that it revokes the previous one or that all other powers of attorney are revoked. While your caregivers must respect your agent's decisions and the court will uphold them, the agent can be removed by the court if doing so is determined to be in your best interest. Your physician and the hospital will also play a part in that decision. The Illinois State Medical Society booklet entitled A Personal Decision includes a short-form, durable power of attorney for health care that is legal in the state of Illinois. This form is not required, but it is the surest way to meet all the specifications of Illinois law. If you decide to execute the durable power of attorney, be sure to inform your doctor, the hospital, and your family. Keep the form in a safe place and let someone you trust know where it is. For people specifically concerned about mental health care, the state of Illinois has a unique document limited to 3 types of mental health treatment. This document is known as the Declaration for Mental Health Treatment. Using this document, you can designate someone else, called an attorney-in-fact, to make decisions about your mental health care in the event you are unable to do so yourself. This person can, by law, be anyone you choose who is over the age of 18, except your attending physician and people involved or related to the physician or your health care facility. This person will have the legal right and responsibility to make limited decisions about your mental health care concerning electroconvulsive treatment, psychotropic medication, and admission for up to 17 days in a mental health facility. Most people select a member of their family or a close friend to act as their attorney-in-fact in these situations. Whomever you choose, you should discuss your wishes with them. The ISMS Personal Decision Booklet includes the statutory Declaration for Mental Health Treatment form that is legal in the state of Illinois. This form is not required, but it is the surest way to meet all the specifications of Illinois law. If you decide to execute a declaration for mental health treatment, be sure to inform your doctor, mental health care professional, and your family. Keep the form in a safe place and let someone you trust know where it is. The living will does not appoint another person to make your health care decisions. It does declare your intent that if your medical condition is incurable and irreversible, the people taking care of you should not delay your death, if it is imminent, through life-saving measures. It allows you to control your health care even if you cannot communicate with the people caring for you. For example, a cancer patient whom the doctors estimate has only weeks to live can, through the use of a living will, instruct the hospital that no extraordinary measures are to be taken to prolong his or her life. If the patient suffers cardiac arrest, for example, the hospital is not to attempt to revive the patient. The patient may also choose to decline future use of a respirator or techniques such as blood transfusions or kidney dialysis. The Uniform Do Not Resuscitate Order Form, or DNR, allows you to designate when you would not want healthcare professionals to use cardiopulmonary resuscitation. You and your physician can execute this advance directive, which must be honored by healthcare providers in Illinois. This form and guidelines for healthcare providers and professionals and patients are available on the Illinois Department of Public Health website. You can, at any time, amend, alter, or void your living will or durable power of attorney by destroying the document or preparing a written statement declaring your intent to set them aside. A declaration for mental health treatment may only be amended or revoked by competent persons in writing and signed by the patient and physician. Incompetent patients may not amend or revoke a declaration. The statutory forms allow you to direct your family, your health care professionals, and others involved in your medical care to follow your wishes should the time come when these difficult decisions must be made. You do not need to consult an attorney to put any of these into effect. However, it is very important that you discuss your decisions and these documents with your family, your physician, and your legal advisor to assure that your wishes are followed. If you do not execute an advance directive and you no longer have the ability to make decisions, a surrogate may be appointed for you. This surrogate will have the authority to make medical treatment decisions for you. In other circumstances, your hospital, another healthcare institution, or doctors may be required to do everything in their power to keep you alive, no matter what your condition or chances of recovery. If your medical condition is terminal, incurable, or irreversible, or you are permanently unconscious, your surrogate may also make life-sustaining treatment decisions for you. A surrogate, other than a court-appointed guardian, may not consent to administration of electroconvulsive therapy or psychotropic medication or admission to a mental health facility without court approval. Newly admitted nursing home residents who do not have a guardian or who did not execute a power of attorney for health care must receive written notice of their right to name one or more potential health care surrogates who could be chosen to act on the resident's behalf should the resident lose his or her decision-making capacity. For more information on advance directives, visit the Illinois State Medical Society website at www.isms.org and click on the For Patients tab.